Hello. Welcome to TSC Talks, the source cannabinoids, the podcast inspired by the condition known as tuberous sclerosis complex. My name is Jill Woodworth, and I am your host. Thank you so much for tuning in today. I'm psyched to announce this segment of our podcast where we're doing a content arc on what is a green nurse. And this particular episode is a compilation with pieces from past podcast guests that happen to be green nurses, each kind of giving a little bit of a glimpse of why they got into green nursing or an experience that led them there, just to kind of set the stage for this arc. All these women really have had an impact on me personally. As I got into the cannabis industry, all were willing to come on the podcast and talk with me, share very personal details, and just kind of pull me along my own exploration of cannabinoid medicine and where I was at with my loved ones, trying to help them reduce pharma, personally as an entrepreneur, business person, bringing me along. So I appreciate all of these women, all of the green nurses we've had on the podcast, nurses, and I think they're doing amazing work, and you're going to enjoy this content arc immensely. So I'm just going to tell you a little bit briefly about each of the people that are on this particular episode. We have Marissa Fratoni, and she was on my podcast back in November. She is from Central Mass, and she got into cannabis nursing through some experiences in traditional nursing and visiting nurses where she was faced with the gaps in the system and just frustrating situations, and ended up working in a dispensary and realizing the potential of cannabinoid medicine, and shifted over to cannabis nursing and a platform, Holistic Nurse Mama. She also runs this Facebook group called Moms Who Elevate, which is fantastic and really has reduced the stigma personally for me, coming out about my own cannabis use and making it really not such a stigma in terms of being a stoner or whatever, but, just encouraging each other and connecting and validating our experience using cannabis for whatever reason. So awesome lady. And then after that, I have Janna Champagne, another awesome individual. She is also a cannabis nurse. She has a platform, Integrated Healthcare Solutions. Had her on the podcast. She also has a daughter on the autism spectrum. She got into cannabis nursing through her own health crisis and wanting to help her daughter who was on the autism spectrum. She speaks a lot about the mental health issues and the overuse of pharmaceuticals. She has a lot of experience with nutraceuticals and really in the great alt med space with the autism piece. I know she's working on a residence that integrates cannabinoid medicine for special needs individuals in Oregon, which I want to hear more about soon, and we'll put that out there. So Janna's fantastic. And after that is Sherri Tutkus, who I've had on the podcast a few times. She is the founder and CEO of the GreenNurse group. She has an amazing platform here in Massachusetts, extensive people that work with her. Erie Bliss Wellness is the shop and another aspect of her business. And she has a podcast, GreenNurse on the Grow, with another green nurse who talks about first-time growing, Dedee Culley, who was also on the podcast. Sherri's got a lot of big plans and expanding her platform, so really excited to have her on and working with her on this whole arc. She's just a real mentor to me, honest, funny, and I love her. And then after Sherri, I have Dedee Culley. Bumped into Dedee, I'm not sure, somewhere on social media, and she poured her heart out to me about what she'd been through with her husband, who was diagnosed with brain cancer and had heart attack issues, and then how she got into cannabis nursing through her own family past experiences, being an observer and a questioner, noting some post-vaccine damage to a relative, and then seeing her own grandmother with Alzheimer's in a nursing home, dealing with the traditional healthcare system and medications and some issues there. She wanted to educate and realized that the cannabis was working for her husband, helping him collaboratively with his treatment for brain cancer. So she's started Two Leaf Nurses, and I hope I got that right. And yeah. Anyways, she's awesome too. So I hope you guys really enjoy this. I just want to take a moment to add a personal piece here. Recently, a medication called Epidiolex was approved by the FDA for use with tuberous sclerosis complex, and Epidiolex happens to be CBD isolate at a rather high dose. And I'm just putting this out there because I have concerns with this, and I think the more we talk about it, the more we can find ways, since it's already approved, to work with it. And I was irritated that this wonderful plant was bastardized by pharma in this manner, and perhaps haven't heard the other side of the story, but from what I see on Facebook groups and boards, and I'm just really putting this honestly out there, I see a lot of side effects, it being prescribed by doctors who don't understand the endocannabinoid system, don't understand the impact of CBD on other medications, and people that are trusting these doctors to guide them, and there's just been a lot of less than advantageous results. I think it does work for some people, and as you know, if you are experienced or knowledgeable at all in a little bit of cannabinoid medicine, the entourage effect is quite important. I'm sure that will be touched on in this series, and with the CBD isolate, you're not going to be able to take advantage of that, and it's one of the beauties of cannabinoid medicine. So I have mixed feelings on Epidiolex being approved. If it can help people better than other seizure meds, great, but I think until the medical system embraces the endocannabinoid system in their education and practice, it's going to be frustrating. So those are my thoughts on that, and I'm going to stop talking. And thanks so much, ladies, for being on my podcast, and I'm looking forward to this segment so much to learn more about you all green nurses. All right, over and out. So you said a little bit about yourself. How did you get into nursing? Give me a little bit of background on that and how you became a cannabis nurse.
I realized that I loved helping people. I was very passionate about it, but my body was starting to really show a lot of wear and tear, and I needed to find a different stay in the realm of healing. So nursing really drew me in, and I, chipped away at it for a long time. I lived all over the country, Florida, California, North Carolina, and then I'm from Massachusetts. Yes. So we landed back here after all of that traveling, the man who I would marry in 2009. We landed here in Massachusetts in 2008, and I put myself through nursing school, finished up in 2011. My nursing career, I started in the operating room, which is like the least holistic place in the medical field. But it was an opportunity, and I needed to take it. It was a foot in the door. I did that for 2 years, and then I went into visiting nursing, and I did that for several years. Visiting nursing was certainly something that I really loved. The operating room certainly challenged me at all times, but it wasn't my love or passion. I love taking care of people when they're awake. You don't do a whole lot of that when you're in the OR. Patients are always sleeping. So visiting nursing really opened my eyes to what patients experience, what the pitfalls and the shortcomings of the medical community really are. And eventually I came into a really difficult time in the visiting nursing field, mainly my agency. I was struggling with the management and needing to look for something else. So on a whim, literally, I threw up my resume out to a dispensary who's looking for health professionals to open up and start their company with. And that's how I got into cannabis in early 2016.
Okay. So when, kind of right before it went rec.
Yeah.
Yeah. Got approved.
Yeah. It was medical here. But that was a major eye opener for me. I mean, I have used cannabis recreationally, and I realized medically later. I used to use it to take care of really bad headaches and pain. But yeah, I've used it for a long time, as a teenager in New England. And working in the dispensary just completely changed my entire perception of the plant. I was interacting with people who were very chronically ill and seeing miraculous changes in their overall quality of life with the use of cannabis. And these are things as a visiting nurse I didn't see. My patients were always, a lot of them were very compliant with their pharmaceutical regimens and whatever their doctors were telling them, but they weren't healing. And what I saw in the dispensary was cannabis patients consistently coming in and saying, this is helping me. It's improved my entire life. It's changed my life. I mean, those are things that I was not hearing as a visiting nurse. So it was very empowering, and it really changed my trajectory completely.
Okay, so, I guess I did some reading on that you wrote about addiction and using cannabis. Do you want to talk a little bit about that? Just, it's a personal area of interest to me. And
sure.
Yeah.
So in my visiting nursing background, I was doing psych visiting nursing.
Okay.
So I worked with a lot of people who were struggling with, well, not necessarily struggling. I had a lot of people that were in recovery. And then I have worked with the recovering community. I used to do some work with a transitional living environment for women. So beyond that, in my own professional practice, I found that some clients have used it as a harm reduction tool. Mm-hmm. So people that are addicted to opioids, for example, they may benefit with a little bit of cannabis use to help them with the symptoms of weaning and detoxing, mm-hmm. nausea, vomiting, chills, all of these icky things that come from, really struggling through that detox. It's a rough detox. And there are some people who have really benefited from the use of cannabis during that time. Again, I recommend you do not want to detox from opioids, without medical oversight and guidance. So do not use cannabis for the purpose of trying to detox yourself off of an opiate. It's not safe. Same with alcohol, not safe at all.
Yes.
Any medication really that's, over-the-counter prescribed, if you've been using it for a long time or any time, really, get under the care of a health provider, physician, or an NP who is really aware of your diseases, your conditions, and what your goals are. Mm-hmm. As far as maintenance, I know a few addicts, people that identify as addicts. I don't call people addicts, I call them struggling persons, but some people do identify as addicts. And a couple of my husband clients, and they've said that for them, one of them was a heroin addict, and he uses cannabis as a way to, he needed to change up his ritual. He did that, and that ritual that sort of fills that void that he feels from not using heroin.
It makes sense.
It does. I mean, I can see that. Dr. Dustin Sulak, he's an integrative health provider up in Maine. Okay. You can find his website, healer.com. He has done a wonderful body of research. He has his own cannabis practice, and he's done a lot of he's provided a lot of research and evidence for using cannabis as a harm reduction tool in relation to the opioid crisis. So yeah, definitely check him out. I go to his website to learn about how I can help clients who are struggling with substances.
That's great. That's a really good resource.
Yeah. Fabulous research.
Put that in, along with all your other links. This is Janna Champagne. Starting using cannabis with your daughter, and how was that difficult? Was she on any meds?
Well, thankfully, because I had already experienced cannabis myself, I was very comfortable with it. Mm-hmm. I was comfortable with its safety profile. It's never killed anybody ever in over 5,000 years of historical use. I was comfortable with the effects. I had seen stories of other parents utilizing it, and there's even videos of parents who are showing a child with autism in a full-on rage, and they're beating themselves up, and they give them a hit off of a vape device, and within just a couple of minutes they're calm and they're happy and they're sitting in their rocking chair and at peace. Okay. So I had seen those stories as well and thought, wow, instead of the mental health pharmaceuticals, which they have a lot of terrible side effects. Oh gosh. Some of them can even be permanent. If you start a child on something like Klonopin, they can suddenly develop tics and gait issues, and they're just so horrible for quality of life. They're so aggravating.
Yeah. And you're prescribed
even
different ones for different organs, and no one's communicating about the cumulative long-term impact of that. No doctor to date has been able to give me the answers that I've been looking for on, okay, you're giving me these 20 prescriptions that I have to give my kids daily. How is that going to play out long-term? And I've already seen I can already see it. They're just barely hitting 20, one's over 20. And I can see, because I was on a lot of, psych meds, went through, like I mentioned, it was a lot of crisis, and I depended on alcohol and psych meds combined. And then when I got finally kind of stepped away from the medical, whatever, it wasn't working for me. And I knew enough about cannabis that decided I would take a chance and kind of wean myself. Of course I did a lot of research, wean myself off. And it's like a different life I'm living in a lot of ways. Very challenging, because I had used psych meds for so long. Like you have a different baseline. It's just kind of different. So, it's just my biggest, well, not biggest, one of my pet peeves is these psych meds that these kids with TSC are on long term with all the other things they're dealing with. If there's one thing we can hit at with cannabis and, take away a few meds, certainly there might be meds that they need to remain on. I don't know, but that's one of my motivations is the mental health piece. And, and then the mental health industry is so disconnected and they really, it's not integrated at all with the medical, and as you well know. So it's like the Wild West in terms of figuring out how to get everybody to collaborate, if it's possible at all, which, yeah, anyways.
Well, yeah, it's difficult. In mental health, the approach is you have these symptoms, they match the DMS profile, they label you with something, they throw you on a medication that they think might help. There's no objective lab testing done to actually see what's happening with the neurotransmitters. Because mental health disorders are a physical imbalance.
Preach.
It's not, yes, I will.
Please do. I've been at meetings where I've said, okay, you can apply that label to her, but fundamentally she has TSC. This is a organic, part of her body has got these tumors all over it. And you can't tell me that's not contributing to her mental health.
Right.
Yeah.
Right. And so the approach is not scientific.
Yeah.
And that
makes sense.
Oftentimes I have seen where they'll try a medication on somebody, and because they're not taking a scientific or objective lab approach, they chose the wrong one and actually made the problem worse. I see that a lot.
Or they add on another med.
Exactly. And this is my theory behind all the school shootings. Here we go on a tangent.
Totally cool.
Every school shooter has been on a mental health medication.
Yeah, I think I remember noting that.
If you boost somebody's serotonin too much, they become extremely aggressive. Some of the medication side effects are apathy, which means they don't care about anything or anybody, and suicidal ideations. Yep. These are known side effects of these medications that the school shooters have been on, every single one of them. Wow. So we're making the problem worse with some of these pharmaceuticals and this approach. And as far as, you said you can't get answers from your doctor about the long-term effects of the mental health meds. That's because they haven't been researched.
Right.
There's zero research.
That's been around
and the effects
forever.
We do know are bad enough. Look up extrapyramidal symptoms.
I know what that is, actually.
Yeah.
That's like,
they're awful.
God, what is it? Heavy duty, antipsychotics. I know that's.
Yes. Where you get gait issues, you walk like a robot, you get facial tics, I've seen a tic where somebody was constantly licking their lips. Body tics. It's miserable. And on some of these medications, somebody will start a med, get that side effect, stop the medication right away, but the side effect is permanent.
Oh man, yes.
So they're extremely high risk. And as a nurse, my approach has always been, with my daughter, with myself, with my patients, we're supposed to weigh the risk versus benefit of all of the options and guide our patient to make an informed decision And obviously, ideally they would choose the least risky options with the most potential benefits. And I have seen I've worked with thousands of patients directly, individually. And it's so commonplace for patients to reduce their reliance on pharmaceuticals once they start cannabis therapy and really improve their quality of life. In the elderly population, I've seen reversals of dementia.
Really?
In the autism population, I've seen improved behavior, improved quality of life, improved function.
Wow. So
because cannabis is providing balance to all three of those systems that are out of balance in autism: the gut, the brain,
endocannabinoid system,
and the nervous system. Yes. And as far as mental health, there's also a huge link there with the gut and the brain connection. And there's a diet called gut and psychology syndrome, or GAPS diet, that's actually reversing things like schizophrenia, bipolar, borderline. Just by healing the gut, you can actually help provide better balance to the brain. So there's ways to address this that are far more targeted towards those contributors to the imbalances than the mental health meds.
Mm-hmm.
It's the take home.
Wow. But we're not being given the full range of choices for multiple reasons.
Not by mainstream physicians, typically not. If you get into integrative physicians or functional doctors,
functional medicine,
or naturopaths, osteopaths, they're often more, better educated about the alternatives to pharmaceuticals, where the mainstream MDs are typically pharmaceutical driven and they're not thinking outside of that box typically.
Yeah, that's a gridlock that it's going to take some momentum to change.
Well, there's so much profit.
This is Sherri Tutkus.
So I'm going to talk a little bit, I'm going to be a little bit transparent today. I think it'll be really helpful to talk from my own personal perspective in working with cannabinoid therapeutics and mental health in regards to my own mental health.
That's great.
Yeah, I think it'll just make sense. So before I got sick in 2012, I had a history of migraines and ADHD. So the attention deficit disorder. So both of those were managed very well with medications, working full time as a nurse in the big teaching hospitals in Boston, 3 kids. My life, I was highly functioning. It didn't impact my life. When I took a hit from eating a bacteria while I was working and ended up in the intensive care unit, with a megacolon, an infectious disease. Yeah, it was really bad. So I got sick in 2012, took a hit to my gut. I went from high functioning to not functioning at all.
Really?
Yes. So in a matter of like 2 days, home thinking I have the flu, one point I get up and I can't even walk. I'm in so much pain.
Really? Wow.
So ended up in the, emergency room, intensive care. I had this condition called Pseudomembranous C. diff colitis. Y'all out there know what C. diff is? It is a stinky, horrible, horrible disease that I would not wish on my worst enemy. And how I got it, the majority how most patients get this is from antibiotics, or they can get it in the hospital. It's an acquired infection. Well, I was healthy and wasn't on any antibiotics. I was only being treated for migraines and ADHD. So I had a completely healthy gut, working 50 plus hours, single mother of 3 with, 3 kids. One of my children has a disability. We've talked about him before.
Right, and I want to know how you managed all that too, but keep going.
It was very difficult. It was, so high functioning to not functioning. So you're going from here to here, completely down to the bottom of the barrel.
Which is like our worst fear as driving, trying to keep up with what is expected of us in society, moms. Yeah, that's a lot.
So I was on the other side of the bed, like in a really big, bad way. All of a sudden I'm the patient. And having to advocate for myself. So not only, was it the physical issues that I had, but I also had to deal with the system, the system that I worked in,
right. Okay.
How is that going to affect my mental health, and how are they going to take care of me? And it was really, really, the trauma that I experienced from this illness is so overwhelming. High functioning to not functioning, home bedbound, in the hospital, couldn't take care of my kids, could barely eat. Have issues. I'm just going to say it like it is. Explosive diarrhea, nausea, vomiting, abdominal pain, pooping your pants in public. Okay? Oh
my God.
So you can see how, and literally I can talk about anything. Like literally I would run around the block naked to talk about poop and stuff that comes out your bum. Sorry. I was so mortified, horrified that I had this gastrointestinal illness that was debilitating.
Complete loss of control.
Like in all ways.
Yeah.
So, like literally. It was horrible. And then the issues with eating and being able to take in food. So that spiraled into, mental health issues, developing the anxiety and the depression. And over time, I wasn't getting better. Agoraphobia, afraid to leave my house.
Okay. So you were at home. You had to stop working?
Yeah. So I went from the hospital. I was in the hospital for a few weeks and then came home, and I was on mega doses of antibiotics, oral antibiotics. I was on IV antibiotics in the hospital. I couldn't go home until I could take oral. And multiple pharmaceuticals. And that's when I started my Polypharmacy Journey. So it was basically started off with a gastrointestinal illness, the C. diff colitis, on IV vancomycin, oral vancomycin, Flagyl, steroids, you name it.
Wow. So
narcotics, anxiolytics, antidepressants.
Okay. Wow.
So it went from that. Then from there, the mental health. So I've always, I've had ADHD, and I've always been interested in mental health, anxiety. I've had a history of anxiety, and it was related to the ADHD. So I've been connected to a psychiatrist and a behavioral therapist for a long time. Mental health is really, really important to me. So I've already was hooked up with them,
right?
Which was good, which is very helpful. But then, there's the medication adjustments and, getting the appointments and being sick and not being able to leave the house, and how can you get to the appointments? So there's the whole powerlessness of wanting to get better and take care of yourself and having nothing work. So it went from the gastrointestinal to the mental health issues to the severe stress, panic disorder. I'm not going to lie, like horrible panic attacks.
I hear you. I've had them, and I thought I would never be a person that would have that happen to me.
Me neither. It was completely
I used to think it was like, no.
People make it up. That's what I was thinking.
Exactly.
Oh, making it up.
It's all in your head. Yeah.
So the mental health piece of it. And then the next piece of it is they discovered that I had a lump on my breast. Okay. So this was something that I wasn't expecting. It was, and we went to go have the lumpectomy to figure out what it was. Well, it was too close to my chest cavity wall. So they basically said to me with that lump that I would need to have open chest surgery to remove the lump to see what it was.
Oh my gosh.
Did I want to do that? Did I not want to do that? And basically that took a lot of, thinking to do. And I decided to wait, and why am I going to cut myself open? And it ended up going away, which was great. But still, you automatically, it's one medical condition after another. That's like traumatic because you feel like there's something wrong with you. Like, what am I not doing? Like, why isn't anything working for me? And so then from there, I developed another chronic autoimmune condition, which I'd never heard of, polymyalgia rheumatica. Crazy autoimmune condition, which is a chronic myofascial pain syndrome that actually affects, I call it the turtleneck of glue and glass.
Oh my goodness.
From all through neck, shoulders, upper chest, and back, would feel like I had, or with a football player, the whole, like the shoulder girdle thing of pain. It felt like I had glue and glass under my skin. Every time I took a deep breath, it was like sticky. It felt like it was dragging across. I mean, it was a nightmare. It was horrible, horrible, horrible. I became severely debilitated. I wasn't able to take care of my kids. My ex-husband and my boyfriend at the time were there to take care of my kids. I became bedridden.
Wow, Sherri. Wow.
And I'm going to tell you too, and this is the part of trauma that I'm really trying to help patients with now, but when I'm working with them, because I've been there. I've been there. I call it medical trauma. And I also call it
absolutely
pharmaceutical trauma.
Yeah. Pharma injury. Yeah.
So, and it's a real thing. And I've had a lot of traumatic experiences in my life growing up. I've had some issues with trauma. In college, I had some issues with trauma. I've actually, been a nurse for a very long time, working in intensive care units across in these big hospitals. So what I've seen, I've experienced trauma taking care of patients that were trauma patients, and just the stuff that I've seen and done, I was able to handle that. But when it flipped back around to myself and I became chronically disabled, that's when I started circling the drain of despair.
Drain of despair. That's a place a lot of people live.
I know.
I've been there. Yeah, I can relate in different ways, but yeah.
Yep. And it was Cannabinoid Therapeutics that came into my life that really made the significant, impactful change that allowed everything that wasn't working to start working again, and was actually allowed me to start processing information from a different place, because I was pulled out of the story of the sickness, the story or the trajectory of sickness and illness. You know, it was the cannabinoids that actually opened the door that allowed everything that wasn't working to start working again.
This is Dedee Culley.
So I was a late bloomer. I did not plan on going to college. My grandma didn't go to college, so why did I need to go? My mom didn't go to college, so why do I need to go? I just wanted to get married and, you know, raise a family and bake cookies, and that I was totally fine with that, right? Mm-hmm. But from early on, you know, when you ask that question, there's those things that come to your mind immediately, and then there's other things that you think about later.
Yep.
And for me, one of the first times that I think I questioned medicine and the status quo of it was when I was probably about six years old, when I saw a cousin of mine who was 2 or 3 years younger. It's been years since I've seen her, but she was 2 or 3 years younger than me, and I saw her have a seizure, and it was a full-blown grand mal. And they just shuffled us kids, you know, shuffled us out. And I'm going, you know, horrified.
Yeah.
And
sure.
and this was, you know, again, this was in the 60s. So this happening didn't go the way that it goes now. They did things back then that they don't do now, right? We know, and that's not a really good thing. I think, you know, I am glad for some changes. But
yes.
So I remember seeing that, and what had happened with her when I found out was that she was perfectly fine when she was born. She got her first round of immunizations. And then when she got, it was either the second or third, and I think it was the second, suddenly things changed. And she wasn't meeting milestones. She was having problems. And the only thing that they could point that back to were the immunizations. Again, this was in the 60s. And I had to stop and go, why did that happen?
So they connected the dots.
You know, that's really all.
Somebody thought that, you know.
Somebody saw something, and I do know, you know, as a kid, you don't know the details, right. But you know the vibe. You know the emotions that are going on, and how devastated everyone was, and the anger and the worry and the confusion. You know all of those things, but you can't put the pieces together.
Yeah, very well put.
And you know, they did the best that they knew at the time. And I always say that's the most you can ask for.
Absolutely.
So I remember questioning then. I think the next time that I really questioned what was the status quo was when my grandma, who was my absolute rock. My mom was young. She went back to work when I was little, and I spent all of my time with my grandma and grandpa. So I was kind of in that sandwich generation thing, you know. My mom, you know.
That's nice.
But my grandma had Alzheimer's, and I was incredibly blessed. I really was. And she had Alzheimer's, and it got to the point where she had to be hospitalized. They needed to put her in a facility. We could no longer. My mom and my grandpa worked as hard as they could to keep her at home, because that's what we do as a family. That's what we've always done. And they put her into the psych unit and medicated her because she was just extremely agitated. And I understand it.
Yeah.
But they made her, she was comatose. They just completely knocked her out. And my grandma had only taken a Synthroid for her. She had low thyroid, and she took a Motrin every once in a while for arthritis, and she was really in pain. Other than that, she never took any medications. And when I talked to the doctors about that, they go, well, we just thought that the family had made a mistake. I mean, nobody can be in their 70s and not be on this medicine.
Wow, that's some ageism right there. Woof.
Oh,
and
you know, so there we had it. It was horrible. And so I remember asking questions, and I remember this came back and bit me later on. When I asked the questions, I said, I'm not questioning you. I'm not questioning your integrity, your training, your nothing. I'm just asking questions because I need to understand this. And that doctor told me, he goes, don't ever apologize for asking questions. That's how we learn. I held on to that. And we walked through the process and got her off of the medications and started doing things that I was able to go in and I could sit and hold her hand They would call me because they had very strict hours when visitation would happen. And then the nurses would call and go, would you please come up here? I would get up there. She'd be incredibly agitated. I could sit down on the couch, hold her hand, and we would just rub hands. And to this day, I can still feel that. And she was totally calm. And she would look at me, and I could see grandma in her eyes.
I know what you mean.
And I know there was that connection. I took a doll. She always took care of all of the babies in the family, all of the kids. I took a baby doll up there. And she held that baby, and she would feed that baby, and she would cuddle and calm her down immediately. So no medications were required.
Wow.
You know, they didn't have to do all of those things. And it improved, to me, it improved the quality of her life there at the end. But it made me question, why do we do this? And then, of course, I went into, that was the thing that took me into nursing. That's why I always say I was a late bloomer, because my daughter was already, I was in my 30s, my early 30s, and my daughter had just gone back to school. So that's, you know, she had started grade school. So I went in. And that thing that the doctor told me, don't ever stop asking questions. That's how we learn, you know, and encouraged me when I got into the hospital, was told, no, you don't ask questions. We are the doctors, and you are the ones, you don't get paid. I don't pay you to think. I pay you to do what I tell you to do.
Wow. How soon?
That didn't go well for me.
Yeah. How soon into your training did you get that message?
I got that message when it wasn't long after I had started in the hospital. I was probably 2 or 3 years into the hospital, you know, the corporate.
So you made a real commitment to that education, and then you know. Absolutely. Yeah.
Yeah. And then to be told that, you know, you don't get paid to think. You just get paid to do what I tell you to do. That really just didn't work for me.
No.
And me being that kind of person, I said, no, that's not going to work. So I went to work for a doctor's office, which was much more conducive. And then I went into home health, and I absolutely love home health, and have spent many years in that, because I had the opportunity to work with the patients, to really get to know them. In the hospital, you don't get to do that. I would never be critical of one of our nurses in the hospital, or therapists, or anybody, because they're so restricted on what they can do. But it just wasn't working for me. I mean, it was just causing so many problems. So for me, home health was perfect, because I got to know the patients. I got to meet them in their environment. And someone who was on, for instance, Coumadin, the doctors couldn't figure out why they couldn't get their Coumadin balanced. Well, it's because they have a garden, and they love green leafy vegetables.
Right, and you can't have that with Coumadin.
Exactly. Yep. So here's the thing. Yes, you can, and yes, you should, right?
Okay.
You just have to adjust the Coumadin.
Okay.
You know, Coumadin is much easier to adjust, right, with a blood test than it is to adjust what someone who has had green leafy vegetables their entire life. Why would we take something good away from them to give them something that's a chemical?
Right. And that's a wrap. Thank you so much for tuning in to TSC Talks, the Source Cannabinoids. You can check out our website at tsctalks.com. My name is Jill Woodworth, and thank you for listening to this GreenNurse compilation. Check out our shop at thesourcecannabinoids.com/shop. Our CBD CBG terpene blend product created by Mike Robinson, our TSC Talks partner and creator. Awesome product. And keep tuning in for more on the Green Nurses.